Hello and welcome to the Texas Mind Exchange podcast. I'll be your host, Cody Gould. Today we were joined by Alison Mohr-Boleware, the Director of Policy at the Hogg Foundation. We talked about mental health crisis, we talked about policy, and we also talked about destigmatizing mental health in general for all groups in our community. So without further ado, welcome to the Texas Mind Exchange podcast. Just as a reminder, all statements expressed by our guests on this podcast are their own and should not be considered official views or opinions of myself or anyone else at Texas State University. Alison, welcome. Thank you for joining us. I know that usually our audience has been people who are in the mental health world, who are in kind of, Austin in general. But with that being said, I know that the Hogg Foundation has their fingers in a variety of different things.
Yeah.
And with you being the Director of Policy, would love to understand like what that means, just a high level overview of the Hogg Foundation, and then we can kind of parse it out from there and kind of dig into some other interest areas.
Yeah. So the Hogg Foundation for Mental Health covers the entire state of Texas. So we are a foundation that was started by the Hogg family. So James Hogg was the first native-born governor of Texas. So a little Texas history for anyone who doesn't know. And two of his children created the Hogg Foundation in 1940 with the goal to help mental health services across the entire state of Texas and to improve mental health of all Texans. So we do have a focus of the entire state, which is unique because a lot of foundations are just regional focused or, one city focus. But we have grants in 47 of the 254 counties, again, that are all aimed at helping communities have better mental health outcomes, helping communities become more resilient. And also the entire focus is mental wellness and what those communities need for mental wellness and mental health. But then my role as the Director of Policy is to educate lawmakers, state agencies, and other stakeholders about what our communities asking for at the policy level, what our communities needing for mental health and well-being. And what we see a lot of is that communities have really great ideas for what they would like done in their communities, but they need funding for it, or they need support for it, or maybe there's a law that's preventing them from actually doing it. But that's my job, is to help educate people as well as look at what policies are working in other places and trying to communicate that with people in Texas.
Yeah. And those policies, I guess there's a wide range of what they could look like.
Right.
Are there any ones that you're excited about that we've pushed through in the past?
Yeah.
Or like maybe some things that people don't know about or things that you might be excited about in the future?
Definitely. So what I think is important to know is that Texas has had a lot of funding increases for mental health. So what we've seen the last 10 years is that every legislative session, there has been an increase in funding. However, our population has also been growing, and the need for mental health services has also grown. We're hearing a lot from communities that more youth are needing services or are needing help right now. And that's an increase from the demand in previous times. So we're excited about how those funds have continued to increase. But right now we're seeing that there's a lot of uncertainty around federal funding. So we're watching that a lot because a lot of the nonprofits that receive grants from us also receive federal funding from the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. Right now, SAMHSA is being restructured and being moved to a new federal agency. So there's a lot of unknowns about what that federal funding will look like. So we're watching that closely. But what we're excited about is that Texas has really said we care about mental health. It's not a partisan issue. All legislators see the need for it. So that's a huge, exciting thing. There's also been a lot of focus on crisis intervention. And Texas has really identified that we don't want to be a state where there's unnecessary police involvement or where there's unnecessary emergency room involvement when people are in crisis. So there's been an increase in funding for crisis intervention. There's been an increase in funding for something called mobile crisis outreach teams, which I know there are some innovative mobile crisis outreach teams in the Austin area, Hayes and Williamson County. And a lot of communities are saying, we want to do this in our own way. So when the state dedicates funding for it and lets the communities decide how to do it, that's really exciting. And so we've seen that that's been a focus of the legislators. Another thing is 988. So 988 is actually the federal solution to a mental health suicide hotline. It's also called the 988 Lifeline. So the idea is that someone could call 988 the same way that they would call 911, but it would be for mental health crisis. And the bill was passed at the federal level in 2020. It was a bipartisan effort, and now all of the states are implementing 988. So Texas has a bill as of May 15th that is still in play that is looking like it might pass that would create a trust fund for 988 and would study ways to fund 988 at the state level that wouldn't put us dependent on federal funding. So again, what's really neat about that is legislators are recognizing we want Texans to be able to call this line and be answered by Texans. So there's a lot going on that legislators are excited about, but I would say the related to crisis and 988 are two of the biggest ones this legislative session.
Yeah. Is that normal for, I guess, people outside of the state to be the ones that answer a 988 call?
So that's a good question. And that's something that legislators have been asking a lot about this session. So right now, if calls are not able to be answered in Texas, and about the majority of them are, there is capacity for it. But the call centers have identified that there are times where the wait is too long, so the call will go to someone outside of the state. But that's to ensure that someone is answering the call. However, if we have a trust fund in Texas and we're able to get dedicated state funding, that would have Texans answering the calls, which is what we want to ensure is the best practice.
Yeah. That's so fascinating. I never thought that. Usually when you call 911,
right, it's
somebody that's in your immediate area.
Exactly.
And so is there... And I guess I would like to harp a little bit on 988 just because of, top of mind. And I also heard, just being a student, I have a lot of fellow students that also have experience with 988, either working at 988 or organizations that are associated with it. Because from what I've heard, you don't need licensure to be a 988, I guess, respondent.
Yeah,
or what's
you
the
don't.
Word?
Crisis counselor, I think is the term they use. But that's right, Cody. They don't have to be licensed. I think the main thing is making sure that folks they're very heavily trained on crisis, de-escalation and coping techniques. Some of the examples that they've used is that they will help someone, maybe do some anxiety de-escalation right there on the phone. They can do some of those immediate suicide prevention, intervention right there with someone who might be in crisis. And you don't have to be licensed to be trained in that. So that is correct. And another thing that we see is that we really want people who are peers, peer support specialists, and people with lived experience to be more embedded in those systems. So that's a recommendation that we've had too, is for people to be able to use their lived experience because they can really relate to people on the phone and say, hey, I've been there. Let me help you. And that's a little different than someone coming in with a more clinical lens that might not have that same lived experience.
Yes. Yeah. From what I've heard is like the flow of what mental assistance, mental health wellness looks like, meaning, peer support all the way up to a psychiatrist.
Yeah.
And I guess from a policy perspective, is there more dedication or more desire to want to put, I guess, emphasis on that kind of that immediate peer support, crisis intervention system? Or are we trying to funnel more people towards, I guess, psychiatry or psychology or counseling? So
I think I'd say a parallel process happening because I think Texas has long identified we have a mental health workforce shortage. There has been legislation the past several sessions to try to address it in different ways. I think that people are acknowledging we need the entire spectrum. And so we need to recruit people to be in the mental health profession in general. So there's a piece of legislation right now that's looking like it's likely going to pass that would create a mental health professional pipeline program, with junior and community colleges to help people transfer more easily to a 4-year university without losing credits and graduate with the credits that they need to become a mental health professional.
Oh, that'd be amazing.
Yeah. And so that bill's been moving really quickly. It has had no votes against it. It's had, positive reception from the legislature. So there's acknowledgement that we need the entire workforce, the entire spectrum, from psychiatrists to peers to social workers, everything in between. What's unique about that bill is that the pipeline program, doesn't specifically dictate which professionals it would be included. It just says mental health and substance use fields. So what we think is great about that is that would allow more opportunities for maybe peer specialists that are at a community or junior college that maybe they're getting a certificate to become a peer specialist, but they also might want to become an LCDC or a counselor or social worker or something else, that it could incentivize them. However, there are some funds in the budget that are dedicated to peer support specialists for reentry peers, so people that are involved in the criminal justice system. And that's been a part of the budget the last several legislative sessions. There's also been more of an interest in more informal peer support. So there's a few bills right now that are related to first responders having a peer network. That's not the same as a formal peer support specialist or recovery coach, but is more emphasizing the way that first responders can support each other as peers, that they've been through similar traumas and similar situations. So there's kind of efforts there too. There's also a big recognition that we need to keep people in Texas that are getting these degrees. So there's been an emphasis on loan repayment programs. That's really popular with students. Obviously, they want to know that if they get their degree in Texas, they get their license in Texas, they work in Texas, that they could get some of their loans repaid. So there's also a bill right now that would add more professions to that program that already exists and would allow working at a school to be eligibility for that program, and would give a one-time stipend if you're bilingual or if you're working in a county of less than 150,000 people.
Oh, really? Yeah.
Yeah.
Because I know that rural seems to be a really big emphasis, at least that we're seeing.
Yes.
When it comes to, I guess, investing in mental health. I guess that's what you're also seeing at a legislative level?
Yeah. So this loan repayment program was created in the 2015 session with the emphasis on serving Medicaid or Medicaid eligible folks. So those that are lower income and rural. So you had to be in a mental health professional shortage area. So that was the original intent of the program. And so legislators really have acknowledged that we want people that are in these areas to stay in these areas. So there's also been more of an effort with this pipeline program to say, hey, you're going to a junior or community college in this area and you want to stay in this area working, let's make sure that you can get this degree in the mental health field or substance use field and that you stay here. Because typically people that get their degrees and do an internship, they stay in that general area. So that's another emphasis that the legislature has acknowledged and wants to support.
Amazing.
Yeah. They don't want Texans to leave. They're like, if we're investing in you, we want you to stay.
Yeah. I mean, I think that makes a lot of sense. My parents live in Maine. And I think Maine is one of those other states that a lot of people leave.
Yeah.
Actually, probably a lot of people stay in Texas, but maybe not for mental health specifically.
Yes. A lot of people do stay in Texas, but it's the keeping them licensed and keeping them working in the mental health field.
Yes. Yeah. Okay. Yeah. Interesting.
Because there's a lot of burnout. And I know you and I've talked about that before, but people go into this field with really great intentions, and I know that myself because I'm a social worker and all of my classmates, it's like everyone has these goals to improve, the lives of others or to improve communities. And then people get really burnt out because they put their whole selves into their careers. Yeah.
Yeah, that's so fascinating. I'm trying to think about from a legislative perspective or a bill perspective. Is there anything that can be done to combat that burnout? Because it's such a big issue, at least that we're seeing. I've also seen intersection between taking insurance and not being in insurance. And I wonder if some of those bigger topics of burnout and how people are paying for their mental health services, is that something that the Texas legislature is looking at?
Ooh, I mean, that's a large conversation because what is important to know is that the majority of insurance plans in Texas are actually regulated at the federal level. So even if Texas passes bills related to the Texas Department of Insurance or the insurance code, that's only about 15% of plans in Texas. So even if you said, hey, we're going to cover more mental health services through private insurance, we're going to require that they get paid a certain amount, just an example, that would only affect a few plans in Texas. It wouldn't affect the majority of Texans. So I think when we're talking about policy solutions, we really have to look at the larger landscape and think about what is the overall salary of people? What is the work-life balance of people? How are people getting paid? What is the administrative burden of taking insurance or taking Medicaid? Is it hard to get credentialed on those things? I think that when we talk about policy solutions, it's really important not to think of just a one Band-Aid for this larger problem. I think that it needs to be a larger conversation, especially with the federal level having such a large play in Texas. Yeah.
Yeah, that the goalpost keeps moving.
Exactly.
Yeah, that's fascinating.
And with us meeting every other year, it's really hard for something that's a legislative focus. One, it's hard for bills to pass. Two, it's hard for them to be implemented quickly just because of the way Texas is set up. So I always encourage people to not think about policy work as just bills, but what can we do to change the landscape where more people are trying to change the system in which we work in with or without legislation?
Yeah, that's a really interesting point I'd like to talk about for a second, just because this might just be my lack of education in this area. But when I think about like policies and bills, things move relatively quickly in my head.
Right.
That doesn't seem to be the case.
I mean, you're right that they move quickly, but it's only because we meet every other year. And so in Texas, we meet every other year on odd numbered years for 140 days. And there are a bunch of rules that they can't vote on bills the first half of session. So you're correct in hearing, wow, things are moving quickly, but it's because they have been so slow to ramp up. It's like a funnel that there are, 9,000, 10,000 bills filed, and then only 12 to 1,500 bills pass. And they do move quickly. But it's because there's been a lot of conversation typically behind the scenes to get everyone in agreement on something so that it can move quickly.
And then after something is potentially shot down, then getting it spun back up might take another couple of years. Because you said something about like a bill from 2015 is now coming back around.
So that bill passed in 2015, but the program has continued to have improvements through legislation.
Okay.
But it's not an easy one size fits all. It's not like the bill that passed in 2015 was what everyone hoped for. There was kind of this is going to be our entry level solution, knowing that we're going to keep improving it over time.
Got it.
Yeah.
Okay.
Yeah. So it does seem like it's moving fast, but it's because things have taken so long to ramp up.
Yes. Yeah. And I'm sure as, I guess, representatives change and switch, things also, more emphasis on different things probably change. And
Like I would say this is not a heavy mental health session. There's not as much focus on it as there has been in previous sessions. It's other topics that are really taking up the attention of the legislators right now.
Yeah.
Whereas in the 2017 session, they had just had a mental health committee, and that committee had a report that was released right before session. So there were a lot of mental health bills filed that session and passed that session. We're not seeing that as much right now.
What about potential like comorbidities with mental health, like homelessness or things along those lines? Are you seeing more bills that are moving in that direction as well?
So homelessness and housing is an interesting issue because it's kind of either the city level, county level, or it's the federal level. Texas actually doesn't have a lot of funding that they dedicate towards housing or housing programs. They really see themselves as the vehicle to carry out the federal government's funding initiatives. So Texas, while they might have some bills related to housing, it's really not about housing programs or addressing homelessness directly. It's more about trying to create regulations around what they would like for the cities and the counties to do about homelessness. So it's interesting because that's a question that we get, or I should say that's a topic that the communities bring up to us a lot. We did a listening tour with a bunch of our rural grantees, and so many people said that they were having homelessness and housing issues in their area, but it's not an area that has a lot of support for housing because it's a small town or it's a suburban area. And that's a really big issue right now. But what we've seen is that Texas has tended to take it's not a state level challenge that they want to address. They see it more as a city or county issue. And again, that they are responsible for funneling the federal funds. So there hasn't been a lot of push this legislative session for solutions for specifically the intersection of mental health and homelessness.
Interesting.
Yeah.
Yeah. So from what I hear from you, most of the emphasis seems to be on youth, on crisis, and I guess like immediate services, something like more peer support or 988 or things along those lines. Is there anything else that you think we might want to know?
Yeah. So there has been more of an interest too on maternal health.
Okay.
Again, I think when we talk about this, it's not so much a one-size-fits-all policy solution, but there is a bill that's moving that would create a pilot program for covering Medicaid coverage of doulas. And so that's kind of an interesting angle to it because it's not specifically mental health services, but we know that doulas provide postpartum support for parents and families and can really identify when there is a mental health need or a substance use need and help connect those families to services. So that's exciting, and people are excited about that type of prospect. There has been more conversation around fentanyl testing and kind of acknowledging overdose rates. I'd say that's a focus, but right now there is a drug testing bill that's moving, but I'm not sure if it'll have time to pass. But that's one that a lot of the substance use advocates are really pushing for, that would decriminalize testing strips. And that was also something that the governor has supported publicly as well.
Oh, wow. I didn't realize that testing strips were currently illegal.
Yes.
Oh, fascinating.
Yeah.
Okay. Yeah, that would be a really, I guess, probably beneficial thing so that people understand what's going on or what's in the things that they're using.
And the legislator who brought this bill forward, he speaks about it so eloquently because he's a doctor himself, Representative Oliverson, and he's acknowledged that we can't treat people if they're not alive. And so it's the idea that this is a way to be humane by helping people stay alive. And unfortunately, it's kind of stalled out right now.
Gotcha. What about any overlaps with Narcan or things along those lines?
Yeah. So last session, there were several bills that would increase Narcan, the ability to be trained on Narcan, more Narcan programs at the education. I'm trying to think of the exact bills, but there were some that were filed, and I know that a couple passed that would allow easier training for Narcan on college campuses. But there isn't a lot around mandating it. It's mostly around making it available.
Gotcha. Yeah. Yeah. At least in Austin, where we live, but we work in San Marcos. I've been hearing more about Narcan distribution or vending machines.
It's definitely less stigmatized, which is really exciting.
Yeah.
Like we're seeing that kind of everyone is acknowledging that, and I'd say testing strips too are kind of, this shouldn't be a partisan issue. This shouldn't be a political issue. This is again about helping people stay alive.
Yes.
Yeah.
Yeah. It's, the easiest way to help somebody is to make sure that they're alive first.
Exactly.
From what I hear what you're saying.
Yes. Yeah.
You've been working at the Hogg Foundation for a while. Your background's in social work.
Yeah.
What are things that we might have not covered yet that you think are exciting or that people need to focus on that we might have not talked about?
Yeah. So one thing we haven't covered yet is school mental health.
Oh, yeah.
So with Uvalde, the tragedy in Uvalde in 2022, we saw that last legislative session, there was this large conversation around how do we keep students safe? And one of the things that a lot of the advocates in the mental health space are really acknowledging is that students need supports that meet them where they're at, that it might not be full clinical supports. It might not be the need for formal, counseling, but that they need things in schools to help them have a more mentally healthy school. So the legislature is really focused more on school safety. and on making sure that the physical buildings are safe. There were mandates last legislative session that passed related to how schools need to be equipping themselves for safety. But we haven't seen as much emphasis on what can schools do to support students' mental health and well-being. And again, this is one of the top things that we hear from communities when we talk to them. They want more groups to be able to come in, like communities in schools, those types of groups that are really good at engaging students. And again, it's not super clinical interventions. It's like, we're going to do a support group once a week where the students can come and it's optional and, they can come and support one another. And it's really focused on meeting the students where they're at. And a lot of times we hear that students just want to drop by and talk to someone for like 10, 15 minutes. They don't even want like a full hour. So the legislature has focused more on the school safety piece. And we've really been emphasizing as stakeholders, what can y'all do to support some of these larger conversations around schools being, again, supportive of mental health and well-being? At the federal level, there was a bill that passed called the it was a bipartisan Safer Schools Act. And we've seen that in the last month, the federal level has decided not to continue that funding. But that funding was paying for social workers, counselors across the country to be in schools. And we know that some schools have already laid off school social workers because of funding cuts. So that's something that we're watching and that we're hopeful legislators will think about. What can we do to be innovative here? What can we do to, again, focus on what communities want? And it's what communities are telling us that they want and that they need. Parents are saying our kids need help. And again, it's not about them having super clinical interventions. It's not even about them needing the level of going to a residential treatment center. It's about what can you do to learn about how to take care of yourself and coping skills and, healthy relationships and all that stuff.
Yeah. Yeah. I mean, I think from our perspective, both being, I'm in path to be, a mental health professional, you are currently, all that makes a lot of sense to be able to have those boots on the ground within a school, specifically helping students with what they need, no matter if that's a licensed person or not, that I think would be a really important thing.
And when you think about, and I'm sure you see this too, but when you think about who do the students relate to, it might not be someone who is really buttoned up and that's far along in their career. It might be someone who is younger, who can identify more with them. And so we want to make sure that that's always thought about whenever schools are deciding how they want to support mental health.
Yeah. I'm happy that you said that because for a while I used to coach lacrosse at a high school level, and bringing that knowledge of having, I guess, a lot of experience working with an age group that is high school.
Yeah.
When I went to some of my classes and asked them, what happens if I am a licensed professional counselor and a coach of a sport or something along those lines, which you should be allowed to do. It shouldn't be an issue. The problem that I found out is ethically you can't have a dual relationship, which I thought was really interesting. I hadn't been exposed to that before. And I wonder kind of what that dual relationship might help or what that might hurt. I mean, obviously from an ethical perspective, I totally understand it.
Yeah.
But I also wonder about like approachability or kind of having a barrier that might be lowered because someone already knows who you are. Yeah. I think that's a topic that I wish we would talk about more just within, licensed
the mental health field.
Yeah.
And I think that's where there are benefits to peer support specialists, recovery coaches, and kind of that model, because they have their own ethical guidelines, but it is a little different than LPCs and social workers. But yeah, that's right. And it would be different if you were in a clinical relationship with someone and also their coach. But if you were their coach, but bringing in clinical aspects to maybe how you coach, that might be a little different.
Yeah. The line,
some creativity there.
Yeah, the line is blurry.
Yeah,
but I think allows for some really amazing, I guess, opportunities for sure. Yeah.
And there are some unique things too happening with people getting trained in like art therapy, music therapy, and they're also an LPC or a social worker or marriage and family therapist, and they bring those elements into their practice. I've also seen with yoga that there's a lot more integration of doing yoga while also being a mental health professional and kind of bringing that into maybe, a specific course or something.
Yeah, I've noticed that a couple of classmates of mine are current yoga instructors or own their own yoga studio and also want to fold in the background of having mental health knowledge, which I think is really great and amazing. We need to, there's obviously keep things separate in expertise, but also bringing that knowledge can't hurt.
Yeah. And I think it's the reality that people are acknowledging that mental health and physical health are interconnected.
Yeah.
And that's one thing that from the pandemic, I will say has been a positive, is that legislators on both sides of the aisle saw either from their own experience, from their family experience or community experience, that people were struggling and that all of these things were interconnected. Social isolation, people losing jobs, losing housing, that all of this was affecting people's mental health and that there wasn't a need to make it harder for people to access services and that physical and mental health do affect one another. And so I think it's all positive direction that we're moving in that area. There's also been a lot less stigma in the Capitol about talking about mental health, which is also exciting. And so I think just that acknowledgement that physical and mental health are intertwined is really a positive movement.
Yeah, I think that's great. And that also is a perfect transition for the next kind of topic I'd love to talk about, which is trends that you feel like you're seeing or that are coming down the pike.
Yeah. So one of the big topics that we've been asked about a lot, but there's not a lot of data and research on it yet, is about social media and youth. So there's a few bills this session. Well, let me back up. During the interim, so that's the time in between the legislative sessions, they called for a hearing on social media and media use and its impacts on youth. So they brought in a bunch of invited witnesses to share their testimony and their experiences and views on this topic. There were no bills recommended. It was really just talking to experts about what they see. Then there were several bills that were filed because of comments that were made or testimony that was made in those hearings. And so legislators are moving forward on a few bills. They haven't passed yet, but I'm guessing that one of them probably will. But that would either limit youth's access to social media entirely. There are other bills that would require social media to have a disclaimer that says that it would affect your mental health, which I think is a very interesting concept. But I would just say there's a larger conversation around social media right now. We're getting asked a lot, what the research says about it. And I would just say that it's still an emerging conversation. So that's one trend for sure.
Yeah, really interesting. Even on some of our classes, we haven't talked about social media all that much. But while as working in the Translational Health Research Center, we work with a lot of faculty members that are doing research. So I wonder if I'm not aware of any that are doing research specifically on social media, more on veterans and suicide and things along those lines. But that would be a really great topic to look into.
And I'm sure it is being researched.
Yeah.
And we have found some, but it's not as robust as a lot of other things. I think just because social media is also changing so quickly and, research can take a while. I think it's also, the difference between the different social media platforms, how young people are when they start using them, how often they use them, is their parent involvement. There's a lot of kind of factors that go into maybe how social media affects, but I would just say that's one of the trends for sure that people are talking about.
Yeah. And to stay on that topic for a little bit longer. I wonder the self-diagnosis.
Oh my gosh. I have my own thoughts about that for sure. Yeah, because we hear a lot that people might think that they have a certain diagnosis, and we never want to take that power away from someone, especially when for them it might feel good to maybe label something that they have, struggled with or that they have had an experience with. But then I've also seen in the space where mental health providers who are licensed have said that they have people coming in telling them, I have this diagnosis. And the provider is like, well, let's work together for a bit to see what I think as the licensed professional. And so it's just an interesting landscape right now with that. Yeah.
We've definitely talked about that as at an academic level for a while now. And it just seems so interesting where so many people are just kind of coming in with this preconceived notion that they already have one thing.
Yes.
When the diagnosis continuum
Right.
is something that's really important part of the mental health
Right.
process.
And
It's
being
fascinating.
careful especially for younger, for children and youth, that, some of these things might just be symptomatic for a time because of stress in the home or because of a situation that's going on. And that doesn't mean that there needs to be a diagnosis necessarily.
Mhm.
And on the policy side, I think that there is a fear around being overly prescriptive because in Texas, we meet so rarely at the Capitol. Bills take so long to pass that people don't want to put too much into the law, if that makes sense, around some of the diagnoses and things like that.
Yeah, and allowing autonomy for the practitioners, that makes a lot of sense. Totally.
What do you think, though, about more people in general using like therapy speak in everyday life?
Oh, wow. Yeah, that is a good question. I think my immediate gut reaction on that is I'm happy that the conversation around mental health is being sparked continuously.
Yeah.
I love that these barriers are being broken down, or people are kind of focusing on their own, I guess, psychoeducation of what they're going through. I think that that's amazing. I do think that there's potential for it to be a little bit of a slippery slope.
Yeah.
And not fully understand the root of what a lot of the language comes from, and a lot of the diagnosis or kind of how we're thinking about certain mental states or mental illness or things along those lines. So without the, I guess, education on one end, the more of I'll define it as the academic education. I feel like it could potentially be a space for improvement. But when it comes to just opening up the door to talk about mental health in general, I'm so excited about it. But I think that's being able to talk about it in I don't want to say the proper way, because there is no proper way to talk about mental health, but being able to talk about it from a way that is more highly educated. If we can educate everyone at a more or at a higher level, I think that would be great. But as of right now, it seems like sometimes it's a form of telephone, and that it can kind of degrade meanings over time rather than fully understanding what we're talking about at a really high or at a really deep level.
Totally. I agree. And I think that's where we're seeing this kind of dual situation where it's amazing that things are being destigmatized.
Yes.
And it's amazing that people are talking openly about mental health and therapy. But what we also don't want to do is what you're saying, where it's maybe making some of the conversations ultimately harder because things might not be totally accurate. Another thing that could be helpful for this is just more mental health education to the general public, which is why things like mental health first aid is really helpful, and that's gained popularity. There is a lot of legislative or has been legislative action in the past to increase that availability for school professionals and for just the general community. I think things like that are really good to kind of help address just the general knowledge around mental health.
Yeah. I think that's only good for us to continue to open up about it. Especially groups that typically don't talk about mental health, like men specifically. Seems to be, there's been this mentality of just gritting your teeth and getting through a situation. Whereas now I'm finding a lot more people are willing and open to talk about their mental health. We still have a long way to go. I fully believe that, but at least now we're willing to say, oh, you know what, maybe I'm not feeling too good, or maybe something's going on.
Totally.
And having the ability to reach out to somebody seems to be easier than ever. With that said, I want to go back to something you mentioned earlier, which is, I guess, mental health deserts, or places that mental health is not at the level where we want it to be. And correct me if I'm wrong, but I've heard that, I believe it's Williamson County is the only county in Texas that has the proper amount of mental health professionals per person, per capita.
I haven't heard that statistic.
Okay.
But
I could be wrong.
I'll take it. Yeah, I haven't heard that.
But I guess I say that to say, even in these large cities like Austin, Houston, San Antonio, Dallas, there might be a plethora of mental health professionals there, but there's still not enough.
Yes.
And I think that keeps going back to what you're saying about policy, about really trying to incentivize people to stay here and to invest in our communities.
And to take insurance. And to take Medicaid. And to see people that might not be able to pay. Because there's a big difference between insurance coverage and then actual access to services. Because sometimes people will think that, okay, I have insurance. I'd like to see someone. I am acknowledging maybe I'm having some symptoms of depression or anxiety and I'd like to talk to someone about it. But then they start to try to find someone who takes their insurance and they can't find someone who takes their insurance and has availability. Or is someone that, has a similar cultural background to them that they would like to meet with. Especially for LGBTQIA plus community, they want to make sure that that's a safe place for them. Or for people who, are first generation immigrants or other, important minority groups, that they want to make sure that the provider is going to understand them. So it can be really hard to find someone who meets all those criteria, right? And has availability. So I think that's where it's important to not just look at numbers, but to look at how many people are taking insurance, taking Medicaid, taking Medicare, or are meeting with people on a sliding scale. Yeah. And there's a lot of emphasis on helping people to work in the public mental health system. So that loan repayment program, anyone who works for the public mental health system or for the state psychiatric hospitals would be eligible for that. So again, trying to incentivize people to work with the Texans who are kind of in some of these facilities or going to facilities that are really at the highest level of need.
Wow. Yeah.
Yeah, because there is a big difference between people who have private insurance or can afford to pay out of pocket. That is a privilege that a lot of people in Texas don't have, or that maybe they understand, or I shouldn't say understand, that they see it as a need for their family or for themselves, but they just can't make that sacrifice financially to see someone that only takes cash.
Yeah.
But telehealth is helpful too for this.
Yes.
Yeah, and it's grown a ton in popularity. Obviously, with the pandemic, that was a huge part of it. But what people saw during the pandemic is, okay, we can do these services through telehealth. People can get access, in different parts of the state. Like we know that there are people in the Panhandle and in West Texas that are seeing providers from Houston or San Antonio. So that's been huge.
Yeah. There's a couple of things there that I'd love to talk more about. One of which is being, I'm going to go back a little bit, but talking about what do we think the role of nonprofits is, I guess, within this, taking insurance or subsidizing mental health so more people can go. What do you think that that role would be for nonprofits?
So one, I want to back up and say that as the Hogg Foundation, we give grants to a lot of different nonprofits to do things in their community, and we want to support them to identify what their community needs. So what we've seen is that a lot of the grant partners that we work with, they've identified, okay, this group of people can't take insurance. And so they are open and willing to provide what those services may look like, or it may not be services, it may be more informal supports, like social emotional learning or, support groups or things like that, or even building parks or doing things like that might be enhancing the wellness of the entire community. And so we want to support nonprofits to do what their community needs, whether it's more traditional services or not. Now, what the nonprofit's role is, I think it's growing in Texas because the funding structure is changing right now. There are grant programs through the state that nonprofits are eligible for that they take advantage of. And those grant programs are kind of focused on different populations. There's one that's focused for criminal justice involved folks, for veterans and their families, for rural communities, and then a new one is specifically for children and families. And so what we've seen is nonprofits are saying, yes, this is awesome. We want to apply for these types of funds. We want to apply for grants from the state or the federal government to provide more services so that they don't put the burden on the community and so that they're able to do some things without taking insurance or Medicaid.
Yeah.
So it's really more about flexibility.
Yeah. And I guess within that, being able to assist more larger and larger groups of people.
Right.
Which is the most important part about all this.
Yeah.
Yeah, I think that's interesting to talk about, because sometimes I think that just as a person who is operating in this world on a very surface level, when it comes to grants and understanding nonprofits and nonprofits' role, that seems to be something I'm still trying to figure out, because insurance is there, and federal funds are there, state funds are there, and then nonprofits being able to kind of come in and subsidize as well. But I think for a normal layperson or maybe a person receiving services, we don't fully know the ins and outs of what's happening behind the scenes.
And I think that there needs to be a variety of options for people, because I think if we had everything that looked the exact same, that would be really challenging. And Texas is very much focused on, we want to do what's best in our community. Don't tell us what to do. So we like the idea of communities being able to decide, okay, this nonprofit is hearing that this group wants a certain thing. How can we meet that need?
And I guess we might have covered this already, but like maybe what are some of those groups that we're focusing on? It seems to be youth.
Yeah.
I guess first generation Americans.
Yes. Veterans. Older adults.
Yes.
Rural. There's also been a lot of focus this session on first responders and firefighters, EMS, and recognizing the trauma that those folks go through. I also know that there's been some suicide tragedies within the police community. And so there's a big acknowledgement of that as a group that really does need support in the trauma that they go through. I'd also say, just in general, historically underserved communities and what that looks like for those different regions of the state, that it might be a border community, or it might be a community that has not had access to some of the same infrastructure because of their location. So again, looking at what communities are saying would be helpful for them based on how they define themselves is big.
Yeah. You said that the Hogg Foundation, I guess, looks at the entirety of Texas. And as we know, it takes about 10 to 12 hours to get from El Paso to Houston. It's crazy. So we have a large amount of space and a large amount of variety of different people and cultures and areas and things along those lines. It's probably no small feat to take that on, especially from a foundation perspective. So is the way that you look at different, I guess, portions of the state, do you take into consideration a lot of different things, or do you are you all specifically trying to focus on maybe one area and then splintering it out from there?
Yeah, so we have a few different grant programs. So within the policy unit, our grant programs are focused on policy. So we have policy fellow grants that we give to organizations that want to host a policy fellow to build their capacity for advocacy and policy work. But the other grant programs that are managed in other parts of the foundation typically have a specific focus. So it's rural communities. There was a rural focused grant. There's also a grant that was focused in the Houston area, where all of the grantees and grantee partners were in the Houston, Galveston area. But what we really try to do is provide flexibilities so that those communities and those grantee partners can decide what works best for them. And so all of our grants, we really try to add in flexibility and planning time so that they know, okay, we have a commitment from the Hogg Foundation. All of our grants, grant programs, I should say, are multi-year grants, so that they can know, okay, we have a set number of years that this financial commitment will be here, and we can adjust accordingly. Because a lot of nonprofits struggle with, they have 1 or 2 year grants, and that's just not enough time to get things up and running. And especially with the pandemic, we saw that a lot of nonprofits were struggling financially. So,
are you noticing more organizations, I guess, applying for grants, or more types of organizations, or any trends in that area?
A lot more people are applying for grants in general, which is exciting. That means that, people are aware of us. They have learned, what we do, what we offer, but we have more focused grants, I'd say, or more focused opportunities. We don't have a lot of open solicitations throughout the year. So when we do have one, we get a lot of people applying.
I'm sure, there's more one-off, I guess, advice you give to somebody. But as you're watching or seeing things come through, is there any advice that you might want to give people who are applying for grants?
So I will say a plug for, we have a department within the Hogg Foundation called the Texas Grants Resource Center that specifically helps nonprofits apply for grants, helps teach them how to write grants, and helps teach them how to seek out grant opportunities, both at Hogg and beyond. And so I will give that plug for organizations that want to learn more there. And those are virtual trainings as well as some in person. So that can be great for, if you're in the Austin area or not. I think whenever I'm reviewing grants, the main thing I'm looking for is creativity, but also an acknowledgement of what that community specifically needs or what that community is specifically looking for, and the ability to articulate this is how we would support that community in doing this work, and not an overly authoritative approach, but really looking at a creative way to support the community.
Yeah. Do you look for a lot of use of data when you're looking at some of these grants, or is it more of like the plan?
Both.
Okay. Yeah. I know that that's something that our center, the Translational Health Research Center, has focused on for a while, is like helping mental health nonprofits fold in data into their decision making. We have a training called Visualizing Mental Health that hopefully should still be available. But we give out Tableau licenses and train people on how to use Tableau, and it's a really great resource.
Yeah, that's great.
Yeah.
Because I think a lot of times people can tell the story of a need or tell the story of a program, but the numbers are also really helpful. And I think it needs to be both.
Yeah. And I've heard so many people talk about how sometimes data might not reflect the emotion that is impacting that community.
Yeah. But
also the reverse is also true, where the data is really telling a story, but things might seem okay. They might seem like...
That's true.
So I think that folding in like both those things, like you were saying, is a really important part of the process to really get a full spectrum of what is going on and how we might attack that problem.
Yeah, and I think that's also a good translation to what the legislators need to hear, is that not just data, but also not just stories. They really need to hear both. And I think if you're able to tell the legislator, this is what's happening in your district, and give the numbers of that, that's really impactful for them. And if you're able to give stories about how a nonprofit or an organization has been able to support their community in a unique way, and tell some stories and let the person tell a story that's been impacted, that's really effective.
Yeah. Yeah. I mean, that makes sense to me, just from a perspective of like, I need to see all that's going on. And I'm sure from a political perspective, we having the full gamut of understanding what is happening is the most important part to affect policy.
Yeah. Well, and I think it's important for people to remember that there are 150 representatives and 31 senators, and they are all coming to the Capitol with their own districts in mind. And they are there to represent their districts. And so sometimes it can be hard to get everyone to agree on something, obviously, but if you can get your legislator to understand what your community's needs are, and again, make it about an overarching policy goal, and not about a specifics, or not only about small Band-Aids, then the legislator can continue to carry those goals with them as they are thinking about mental health or thinking about community wellness.
Yeah. What do you think is the best way for people to get involved in local politics?
Yeah. So there's, I'd say, two different recommendations I have. The first one is to seek out an organization that is already involved, that you like their approach, and that you agree with kind of the focus area that they have. There are already a lot of advocacy organizations doing this work, and they welcome people to come work with them, work for them, or volunteer with them. So I always say get started there. Also, just watching the meetings, trying to meet with your council person or elected official. But I think just getting an understanding of what the topics are that they are interested in before you kind of jump in is also helpful. And then to have a specific ask is always really helpful. If you have a specific ordinance that you would like for them to pass, or if you have a specific thing that you would like for them to include in the budget, being able to communicate that clearly. And then the other advice I would give is just to see what community leaders are already in the mental health space. There are a lot of mental health or there are already a lot of community leaders that are interested in mental health. Can you team up with them and talk to them rather than trying to go at it on your own?
Yeah. I'm sure there's power in numbers in that way. Rather
exactly.
than you're just trying to go off on your own. If you can partner with somebody or some
Right.
organization, that's only going to increase the
Right.
ability to break through.
Right. See if there's a legislator or a local official that's been talking about mental health or that has done a mental health proclamation or something in the past. And, going that angle rather than starting from scratch is always helpful.
Yeah. Do you have any advice to maybe somebody who is interested in mental health in their community or interested in impacting legislation in any way? Do you have any advice to those people just in general that want to be more involved rather than just like finding an organization?
Yeah.
Is there anything else?
I would say to not give up because this work can take a really long time. It's a marathon, not a sprint. And to be really clear about what your long-term goal is. If your long-term goal is to, increase access to services for veterans, just keep that in mind and kind of be okay with incremental changes because the long-term goal is really what will keep you going because this work is, it's challenging and it takes a long time to see change and to be okay to celebrate the small wins along the way. Having people talk about a topic is a win. Having legislators ask really good questions about a topic, that's a win. It's not just about bills passing. And if you focus only on that, you're going to get discouraged. But if you can focus overall about long-term small changes happening, that's the best advice.
Yeah, I think that's really important because sometimes it could feel like nothing's happening.
Yeah.
At least that's from what I see, just as somebody who lives in this area.
Yeah.
We might have conversations about things, but it doesn't
Right.
feel like anything's going on. But in reality, like you're saying, I think it's a really important shift of a mindset. Say, at least we're talking about it.
Yeah.
That's a first step.
Absolutely. And I think that there's a lot of power in people having conversations and supporting one another because even just where we were a decade ago, people were not talking as much about mental health. And especially in the substance use space, there's been way more of a conversation about overdoses and how to prevent that and Narcan. And I just think that if we stay focused on the long term and see what has happened overall, it can keep us more positive than just focusing on, well, what have I seen in the last year? That's going to get you discouraged.
I think we're closing in on the end here. But that leads me to kind of, I guess, round things out with hearing from your perspective about what people really need to know what's happening on the Capitol. I know we've talked about that a lot, but if you could just cover maybe one specific topic that like people might really, really want to focus on.
Totally. The budget, I would say, is the biggest thing. So right now they are making the final decisions on the budget as of May 15th, but the session ends on June 2nd. And so the budget will determine how the state pays for mental health services for the next 2 years. So with changes happening at the federal level, it's really going to make a difference how the state is going to cover some of these things that might not be paid for at the federal level. So it sounds maybe a little wonky and not as exciting as specific bills, but I think the budget is really the biggest thing for someone to watch. So how do you do that as someone who, doesn't have a lot of time or, this isn't your full-time job? I do encourage people to follow organizations like NAMI, which is the National Alliance on Mental Illness Texas. They have local chapters as well. They are very, very good at communicating for everyone to be able to understand what's happening, where things are at, or other advocacy groups if you're interested in specific topics. And everyone will have legislative summaries coming out in July, June, and that will give an update on where things landed with the budget. But I'd say that's the biggest thing to watch right now.
Great. Amazing. Well, Alison, thank you so much. What is the best way to get in contact with you or the Hogg Foundation?
Yeah. So if you go to hogg.utexas.edu, that's our main website. You can also go to mhguide.utexas. Sorry, mhguide.hogg.utexas.edu. That's a little long, but that's our mental health guide. So for anyone who's wanting to learn more about how mental health services function in Texas, that's my plug for that. If you want to get in contact with me directly, my contact is through the Hogg Foundation website, or you can definitely add me on LinkedIn and reach out to me there.
Great. That's what I think I did. So
Yes.
that's perfect.
That's how we met. Yeah.
Great. Well, thank you so much, and appreciate your perspective on this. I know that the politics and policy is something that we don't talk about too much in regards to mental health, but it is a needed conversation, and I just appreciate you coming down here and talking to us.
Thanks for the invite.
Yeah. Thanks. This podcast was presented by thecentralstate.com. Thecentralstate.com is a consortium focused on improving resilience in Central Texas by using evidence from research to improve human and community health. This website highlights health and research data by county and opportunities to find funding and resources for mental health programs in our area. Additionally, there are interactive calendars that keep you up to speed regarding what is happening right here in Central Texas.